Hello everyone, and welcome back to Healthy Secrets. Today we're diving into a topic that affects millions of us every single morning. That first, glorious cup of coffee. It wakes you up, gets you moving. And for many, it's a non-negotiable part of the day. But have you ever stopped to think about what that daily dose of caffeine is doing to your eyes? The truth might be more complex than you think. Before we get into it, if you want more exclusive health tips that cut through the noise, make sure you hit that subscribe button. And for a deep dive into optimizing your health, check out our premium guide, packed with actionable advice. The link is right there in the description below. Let's talk about what's buzzing on the internet. You've probably seen the headlines. Coffee blinds. Your latte is ruining your vision. These viral claims are everywhere, creating a storm of confusion and fear. Some say caffeine constricts blood vessels so much that it starves your eyes of vital nutrients. Others claim it leads directly to serious conditions like glaucoma, macular degeneration. It's hard to know what to believe. Is your beloved morning brew a friend or a foe to your eyesight? We're going to break down the science, look at the real evidence, and separate the medical facts from the social media fiction. It's time to get to the bottom of this. So, what happens the moment you take that first sip? When caffeine enters your bloodstream, it acts as a stimulant. You know this. It blocks adenosine, a neurotransmitter that makes you feel tired, which is why you feel more alert. But it also has a powerful effect on your blood vessels. Caffeine is a vasoconstrictor, meaning it causes your blood vessels to temporarily narrow or constrict. This happens all over your body, including in the tiny, delicate vessels that supply blood to your eyes. This temporary tightening can reduce blood flow to the retina and the choroid, the layer of tissue that nourishes the back of the eye. It's a short-term effect, but it's the foundation for many of the health questions we're about to explore. This immediate physiological response is undeniable. Your pupils might even dilate slightly, and you could experience a brief twitch in your eyelid, a condition known as myokymia. Most of these effects are minor and temporary for the average healthy person. Your body is pretty good at regulating itself, and once the caffeine starts to wear off, your blood vessels return to their normal state. However, the real question isn't about what happens in the first 30 minutes. It's about what happens when this process is repeated day after day, year after year. Does this daily cycle of constriction and relaxation pose a cumulative risk? That's the mystery we need to solve. Now let's talk about something serious: intraocular pressure, or IOP. This is the fluid pressure inside your eye. Think of it like the air pressure in a tire. It needs to be just right. If the pressure gets too high, it can damage the optic nerve, the crucial cable connecting your eye to your brain. This damage is the hallmark of glaucoma, a leading cause of irreversible blindness worldwide. So, where does coffee fit into this picture? Several studies have shown drinking caffeinated coffee can cause a small temporary increase in intraocular pressure. This spike usually happens within an hour of consumption and fades after a few hours. For most people with healthy eyes and normal IOP, this slight and temporary bump in pressure isn't a big deal. Their eyes can handle it. The optic nerve isn't put under enough strain to cause any damage. However, the story changes dramatically for individuals who already have glaucoma or are at high risk for developing it. For them, every single point of pressure matters. A 2021 study published in the journal Ophthalmology was a real game changer. It looked at a massive dataset from the UK Biobank and found something startling. High caffeine consumption was linked to a significantly higher risk of glaucoma, but only in people with a strong genetic predisposition to the disease. This is where the debate gets heated. The study suggested that for those with the highest genetic risk, drinking more than 3 cups of coffee a day could triple their odds of developing glaucoma. That's a huge finding. It implies that for a specific slice of the population, coffee isn't just a morning habit, it's a significant risk factor. On the other side of the argument, some researchers point out that other studies haven't found such a strong link: type of coffee, brewing method, individual metabolism. The science isn't entirely settled, but it's sending a clear warning signal. So what's the takeaway here? It's all about personalized risk. If you have a family history of glaucoma, or have been diagnosed with ocular hypertension, which is high eye pressure, you need to be having a serious conversation with your ophthalmologist about your caffeine intake. This isn't about scaring everyone away from coffee. It's about empowering those at high risk with the information they need to protect their sight. For them, cutting back on caffeine might not just be a suggestion. It could be a critical step in preserving their vision for years to come. It's a classic example of how genetics can turn a common pleasure into a potential problem. Another huge controversy swirling around coffee is its connection to dry eye syndrome. It's a miserable condition. Scratchiness, burning, blurry vision. The logic seems simple. Coffee is a diuretic, meaning it makes you urinate more. Therefore, it must be dehydrating you. And that dehydration must be drying out your eyes by reducing tear production. It sounds plausible, right? For years, this has been the standard advice. Doctors, myself included, have often told patients with dry eyes to consider cutting back on caffeine. It just made sense, based on what we knew about diuretics and overall hydration. But here's where science loves to throw us a curveball. Newer research is challenging this long-held belief. A 2014 study published in PLOS One looked at moderate coffee drinkers and found that their daily coffee habit did not lead to dehydration. In fact, their bodies seem to adapt to the regular caffeine intake. And when it comes to the eyes specifically, a 2012 study from the University of Tokyo delivered an even bigger surprise. They found that caffeine consumption actually increased tear production in their study participants. It was a completely counterintuitive result that turned the old advice on its head. How could this be possible? The researchers believe that caffeine's stimulating properties might extend to the lacrimal glands, which are the tiny glands responsible for producing the watery component of your tears. By stimulating these glands, caffeine could potentially help combat certain types of dry eye, rather than cause them. This has sparked a fascinating debate in the ophthalmology community. Some experts remain skeptical, arguing that the effect might be temporary or that it doesn't apply to all types of dry eye, especially those caused by inflammation, poor tear quality, rather than low tear quantity. The science here is still evolving, and we don't have a final verdict. The effect of caffeine on tear production might depend on the individual, their genetics, and the underlying cause of their dry eye symptoms. For now, the best advice is to listen to your own body. If you have dry eyes and you notice your symptoms get worse after you drink coffee, then it makes sense to cut back and see if it helps. But if you don't notice any connection, there may be no reason to give up your morning cup based on the fear of it drying out your eyes. The evidence just isn't strong enough to make a blanket recommendation. Beyond pressure and dryness, what about the long-term health of the most critical parts of your eye? Macula, the center of your retina responsible for sharp, detailed central vision. Lens, which can become clouded by cataracts. The concern here often circles back to blood flow. The theory is that decades of daily caffeine-induced vasoconstriction could, over time, lead to chronic undersupply of oxygen and nutrients to the retina. This process, known as ischemia, can contribute to cellular damage and could accelerate age-related conditions like macular degeneration. The research into this area has produced shocking and contradictory results. For instance, a large-scale study suggested a potential link between heavy caffeine intake and a type of macular degeneration called exfoliation syndrome, which is also linked to glaucoma. The findings hinted caffeine might contribute to buildup of abnormal protein deposits in the eye. However, other research points the opposite way. Some lab and animal studies suggest antioxidants in coffee might protect the retina, potentially shielding it from oxidative stress, a key driver of AMD. Then there's cataracts, the clouding of the eye's natural lens that makes vision feel like you're looking through a foggy window. This is one area where coffee might be a hero. Several large observational studies found a correlation between higher coffee consumption and lower cataract risk. The prevailing theory, antioxidants in coffee, like chlorogenic acid, help protect the lens from oxidative damage caused by UV light and other environmental factors over a lifetime. So we're left with a mixed bag of evidence. For every study raising a red flag, another suggests benefit. It doesn't mean the science is bad, it means the relationship is complex. The effects of coffee are not one size fits all. They likely depend on your genetics, your overall diet, how much coffee you drink, and even how you brew it. We can't label a single food or drink simply good or bad. The truth lies in nuances, many still actively investigated by scientists worldwide. Given all this conflicting information, who really needs to be careful? The first and most important group is anyone with a diagnosis of glaucoma or a strong family history of the disease. If you fall into this category, the evidence linking high caffeine intake to increased eye pressure and glaucoma risk is compelling enough that you should limit your consumption and discuss it with your doctor. The second group includes individuals with certain genetic markers, like those identified in the UK Biobank study. Knowing your family history is a good proxy. It's about being proactive, not paranoid. So, how can you enjoy your coffee without worrying about your eyes? Moderation is key. For most healthy adults, 1 cup, 2 cups per day is unlikely to cause any harm and may even offer some benefits, like that potential reduced risk for cataracts. Timing also matters. Avoid chugging a large coffee right before your annual eye exam. It could temporarily skew your IOP reading. Hydration is also crucial. While coffee itself might not be dehydrating, drink plenty of water throughout the day. That supports good tear quality and function. Let's quickly summarize what we've learned. Coffee can temporarily increase eye pressure, a big concern for those at risk for glaucoma. The debate over dry eye is still open. Recent studies even suggest coffee might boost tear production. For macular degeneration, evidence is murky and contradictory. For cataracts, coffee appears protective thanks to antioxidants. The science is far from settled, and that's okay. Nutrition and health are complex. It's a field of constant discovery. Now, I want to hear from you. Based on the science we've discussed, what's your verdict? Does coffee damage your eyes, or is it mostly safe? Share your opinions and personal experiences in the comments below. Let's have a real debate on the controversial points. Check out our next video where we'll tackle another health myth. Thank you for being part of the Healthy Secrets community and for staying curious. Your engagement makes this all worthwhile. See you in the next one. And if you haven't yet, subscribe so you don't miss exclusive content. And grab our premium guide to minimizing medical bills, paying less for medications, and accessing fair healthcare prices. Link in the description. Stay healthy, stay curious.